afternoon and welcome to the Multicultural Media Online Conference hosted by the Ministry of Health, Multicultural Health Communication Service, supported by Multicultural New South Wales. I'm Jesusa, Helaratne, Deputy Director of the Multicultural Health Communication Service, and we're so pleased that you've joined us today. Thank you very much. Before we begin, I would like to acknowledge the traditional owners of the land from which we are all joining from today. We are joining you from the land of the Camaragal people, part of the Eora Nation. We pay respects to elders past, present, and emerging, and extend that respect to Aboriginal people joining us today, our colleagues and services and communities. I'd also like to acknowledge people of migrant and refugee backgrounds who have come from around the world to make Australia their home and contribute to our rich multicultural society. Thank you for joining us. We are very pleased to have today some very important guests. As you know, October is Mental Health Month in Australia, and it is time when Australian community comes together to raise awareness and promote better health, mental health for all, and we're focusing on mental health and messaging and well-being of multicultural communities. And today we have with us Dr. Murray Wright, New South Wales Chief Psychiatrist of the Mental Health Branch, Health System Strategy and Patient Experience here at the New South Wales Ministry of Health. Dr. Murray Wright, thank you for joining us.
Thank you for inviting me.
We also have Vincent Ponzio, Director of Disability and Social Policy of the Mental Health Branch, with us from the Ministry of Health. Vince, thank you for joining us.
Thanks, Jess.
And we have Monica Das, founding member of Haathi in the Room. Haathi means elephant in Hindi, and Haathi in the Room aims to raise awareness and challenge the stigma surrounding mental illness in the South Asian community. She's also a community representative joining us today. Monica, thank you.
Thanks for having me.
Thank you, and we are going to be asking questions. If you have any questions, please put them on the Q&A and chat, and we'll try to answer your questions. We have 30 minutes, but we have experts here to answer your questions. Murray, first question, why is it so important to talk about mental health for multicultural communities, and how crucial is it to provide support for them?
Yeah. Well, I think it's important for all communities to enable people to talk about mental health, Jess. But I think we know that the stigma and shame that's attached to talking about or acknowledging mental illness is stronger in some particular communities. Why is it important? Because problems with mental health are relatively common in all communities. About one in four people in the community suffer from problems with their mental health at any time. And about 40% of the community will have some lifetime experience of mental health problems. It's common and it's in our midst, and we need to talk about it, because if we don't normalise talking about problems with mental health, then those people who are experiencing difficulties for the first time will not speak up and will not get help and assistance that they need. And so by talking about it, it becomes part of a normal everyday conversation, which I think it should be, and then people who have struggles will actually get the help they need.
Thank you so much, Murray. Vince, what are some of the key issues to be considered in relation to mental health for people from culturally and linguistically diverse communities?
I'll probably build on some of the comments that Murray's made just there. I mean, I think as all communities, there's a range of views about mental health and about mental illness. There are different understandings and beliefs about what causes mental health problems, what causes mental illness. There are different beliefs about the treatments that people should seek, and what to expect from that sort of process. And as Murray said, those beliefs actually directly affect help-seeking behaviour, so how people seek help, who they seek help from, when they seek help, etc. And we were talking about, before we started the conference today, I'm a son of Italian immigrants, and certainly there's an aspect to that community where shame and stigma are definitely related to mental health and mental illness, as with so many communities. And what that means is that at times the early signs of mental health problems people can attempt to keep them hidden, or they can be confined to people's immediate families. And it contributes to the risk of sort of delaying help seeking from professionals, from GPs, from whoever, because there's a shame attached to that issue. What that means is that problems can often become worse because there's a delay in seeking help, and that may ultimately lead to even the risk of hospitalisation, where someone delays treatment and doesn't seek help for various reasons. So shame, obviously attitudes to mental health and mental illness are improving all the time, and there's much more awareness in all communities about the importance of mental health and the importance of seeking help when mental health problems arise. But shame and stigma are certainly, they're definitely a part of the issues that we need to face, and they're important for all of us.
And Murray did say it's about sometimes it is about connection, isn't it? It's just connecting with people and how normalizing the conversation, and that means normalizing the conversation within families and homes. Now, Monica, thank you for joining us. What are the challenges, and Vince has mentioned this, what are the challenges you've faced and from your experience, multicultural communities in keeping good health and well-being?
Yeah, I think there's kind of two big buckets of challenges. I'd kind of describe the first one as very practical challenges. So often multicultural communities find it very difficult to understand how, even if they're at the position that they can seek help, how to do that. So whether it's resources that are available in their language, or clinicians that might be able to speak to them in their language. Sometimes it's also it's actually challenging for them to even navigate the system. So they might be a recent migrant. They've come from their home country and they've come to Australia, and they don't really know where to start, where to go. They don't know that they can go to their GP, for example, as their first step. They're often quite perplexed about how to navigate the system. We on this panel be very aware that we get mental health care plan when we go to the GP. That those sorts of offerings are not very well understood or known, for example, to the community. On the flip side, we've already touched on sort of the cultural challenges in terms of shame and stigma, but there's, I guess, also a couple of other things that multicultural communities could be experiencing. So, for example, recent migrants or those who of refugee background could carry a lot of trauma, and again, that's another layer of challenge in terms of how they choose to seek help, or even fear in seeking help from particular institutions as well. Another thing that we need to think about is people's, I guess, idea of what mental health is in some communities. For example, in the South Asian community, often it's kind of intertwined with religious and other sort of ritualistic type things. For example, people might say, just put some evil eyes in your house and hang a lemon and a chili at your front door, and all the evil spirits will go away. And so that sort of attitude of, we don't actually need to do anything about it. We just need to sort of ward off all the bad stuff. So it's, I would say, more deeply rooted cultural challenges that stop people from actually saying, hey, I might have a mental health challenge here and actually need to do something about it.
And Monica, you've set up a group. You're part of a founding member of Haathi in the Room, which is for South Asian communities. Based on your experience as well, you said that you needed that kind of support.
Yeah, so I had my own lived experience of mental health challenges. So I've had kind of living with depression and anxiety for over 15 years. And I didn't have a space in my community to sort of openly discuss or talk about it, and all those things around shame and stigma just made me basically very much sort of stopped me from seeking help and doing something about it, made my condition much worse, and I realised I'm really scared about talking about it in my community. Or what would the repercussions be? What would the perception on my family be? What if people found out? All of that sort of self-talk. Over the years, I realised actually I can help to be part of creating that safe space and community where it didn't exist for me. And I think we've been able to come a long way in creating, the events and safe spaces for people to actually openly talk about this issue.
Thank you, Monica. And Murray, what do we know that helps communities? Exactly what Monica is saying is setting up connections.
Yeah. So, well, I think to take a step back, I think that we know quite a lot about the difference between communities which seem to be able to manage adversity quite well versus communities that struggle. And this applies across the board, and it applies to communities that are going through external adversity like natural disasters, or communities that have to relocate for a variety of reasons, such as people with migration and particularly refugees. The difference between those communities is about cohesion within the community before, during and after the event. And cohesion is simply another word for connections between people. And those connections actually mean that people know each other, they talk to each other, they care about what happens to the others in the community. So it's not hard to imagine that when you're dealing with an issue, if you have that pre-existing within your community, then that issue is a lot easier to deal with, because my problem is a problem that you might be a little bit aware of and you might be able to assist. So the theme here, which is about talking about mental health, becomes a lot easier if you have these pre-existing connections and relationships, because there's a safe space within the community to explore these things, which are, to a degree, as Monica suggested, it feels a bit dangerous raising this at a personal level, even in a well cohesive community. But that's what the basic issue is, and you can actually make a community cohesive, and particularly when people have come together from all sorts of different backgrounds and places. It's not magic. It's about working at an individual and at a community level.
It starts with one step.
It starts with one step, and it starts with being prepared to get to know people and to have the conversation, and to reveal a little bit about yourself along the way. And so it's I think cohesion is a constant process, because people are coming and going into communities, and there are problems which come and go. But we know for sure that communities which deal collectively with a problem, and whether that's a health issue for one person, including a mental health issue, or whether it's something which is affecting a number of people within the community, that kind of combined effort makes a huge difference to the outcomes.
And that's right, in terms of outcomes in the combined community, and that's where working with services with the community is important.
That's right. I mean, I think in mental health we talk about risk factors and protective factors, and when Murray talks about connection and cohesion, that's very definitely a protective factor in terms of your risk of developing a mental health problem or a mental illness. The flip side is the risk factor of feeling isolated, socially isolated, not having those connections, feeling alone, feeling that you can't share things, whether it's through stigma or shame or for whatever reason. Perhaps you don't have those families and community. You're new to the country and you don't have those connections. So connections and cohesion are a sort of a recurring theme in today's discussion. And part of the challenge for mental health professionals is, again, building that connection with an individual, with their family, with the community, and using those people to develop an alliance and a cohesion for that individual to serve as a protective factor in terms of their mental health. To sort of one of the most important things in mental health for all communities is if you can develop a connection with somebody, and so that sort of therapeutic alliance that is just fundamental to being able to positively influence someone's mental health status. It's really a gateway and a pathway to helping somebody. There's lots of steps on that pathway, but having that engagement with someone and having that real connection is a big thing. And part of that for health professionals is really taking the time to explore how they see their mental health problems, how their community sees their mental health problems, and not jumping to conclusions or making assumptions about how that individual sees it. We know that there's lots of diversity within communities as to how people see mental health. So for people need to take the time to understand that and to be able to respond in a way that's really, that's in tune with that understanding.
And there are services like transcultural mental health that address things or where you can have it in language.
Absolutely. So the Transcultural Mental Health Centre is great for professionals as well as community members. So it's a specialist service that provides in-language support. There's clinical consultation services. There's the Transcultural Mental Health line for people, and they provide support in many, many languages, over 30, 40 languages. So people can get that in-language support for the distress that they're experiencing. So people will have that cultural knowledge as well as the language skills, which is all important. Again, even if you're of the same culture, you can't make assumptions about how the individual is feeling. You need to ask and explore, and again, not make assumptions.
And there's also another service like New South Wales Refugee Service, so it starts.
The Refugee Health Service is a general service, and obviously people of refugee backgrounds are at particular risk of health and mental health problems. STARTS is a particularly, it's been a service that's been around for a while, so that's the service for, let me just get their right name, for basically for treatment and rehabilitation of torture and trauma survivors. So that's, again, a service that provides a range of support services in language. They provide, one of the services they provide is the Witness to War hotline, which is for people experiencing distress due to global conflicts, many of which we're very familiar with at the moment. And they're also played out in people's local environments. So again, people who are affected and distressed by those conflicts can get support through the STARTS telephone lines, as well as Transcultural Mental Health Centre. Transcultural Mental Health Centre also provides a number of resources for professionals. So they're a specialist service that provides support for people working with multicultural communities.
And you speak to someone who's from your community, from your background, and from in your language. So that's really good. There are new resources. If you're feeling overwhelmed with local or global news, there are resources in 35 languages, and we can send that out to communities, and that will be shared on social media and with the email that goes out with this recording. There is a question that we have from an anonymous attendee. Over the past 2 years, many in vulnerable communities have expressed deep disappointment of the lack of meaningful action on mental health, with their concerns often ignored by services, New South Wales Health in some instances. Some communities are struggling far more than others, yet the response has been minimal, according to the attendee, and not grounded in equity. How do we plan to change moving forward? And I think there are consultations happening to make sure that issues are addressed. Murray?
Yeah. Look, I think it's an important question, and I think that it's not just in particular communities. I think there are concerns about the access to mental health services for many people in New South Wales and other parts of the country, and we are challenged because, and in some ways, it is a problem, but it's also a product of us encouraging people to come forward. I think that the open discussion about mental health issues, which we take somewhat for granted at the moment, was completely absent in the public discourse 30 years ago. It was really only in the late 1990s that people started to talk about it, and it changed when some prominent and highly respected individuals actually spoke about their own lived experience. And I was around when that happened, and that was a game changer. And so I think that, and we're talking about that now in relation to in multicultural settings. And to me, that's a really important part of the conversation, is if you've got someone from within the community who can say, actually, you know, I've had quite a successful life, but I've battled with these things on and off throughout my life. It completely changes the dialogue. I think in terms of particular communities who feel like they're not getting the same kind of access as other members of the community, the way our services are organised, we sit within the local health districts, and in each of those local districts, the broad district service, and in particular the mental health service, part of their task is to engage at a whole of community level, and that includes meeting on a regular basis and developing shared plans and strategies with local government, with non-government organisations, with the private sector, and that includes representatives of some of the communities that are prominent within those areas. And my advice would be to seek out and use those kinds of forums, which do happen on a regular basis in many parts of this state, to speak up for what they feel is missing and what they feel would be helpful to them.
Thank you, Mara. And I think, Monica, you've partnered with a lot of the organizations within government and with Haathi in the room and with South Asian communities. How crucial was that in terms of consulting and collaborating with organizations within governments?
Yeah, absolutely. I think, we've over the years, we've been really lucky to collaborate with the Multicultural Health Communication Service, Multicultural New South Wales, and other community organisations in sort of the broader South Asian community as well. I think it's just crucial for us to make sure we are able to communicate and provide the right resources to our own community. Also, I think it's sort of very much on Murray's point, you know, the sharing of lived experience, those events or those projects that we've run, at its core is always around storytelling and sharing lived experience. And I think that brings that cohesion and connection that we've all been talking about this afternoon. So I think, central to all of the things, you know, all those events and projects have looked very different over the years, but sort of the underlying thread has really been, you know, storytelling and sharing of lived experience.
And I think what you said, and that you were witness to when people who are well known, that look so successful and famous and happy, sometimes it's not the case. So in terms of services, in terms of Vince, in terms of how New South Wales, the Ministry of Health and the Mental Health Branch is addressing this is ongoing.
Yeah, absolutely. And you know, we are committed to making our services equitable and accessible for everybody. It's difficult, and Murray's talked about some of the challenges in that. And you know, I'd agree that as the community understands more about mental health, you know, there's obviously a desire and a demand to access those services, whether they be in the public sector or in the private sector, etc. So, but we need to ensure that we are maintaining our commitment to everyone in the community, and that means providing information. It means providing links. It means ensuring that we're going that extra step to looking at the particular needs of people who are vulnerable or who have particular who have a particular disadvantage in terms of perhaps being new to the country, perhaps again not having those connections that we've talked about, and really ensuring that they get the support when they need it, and that's obviously affected by a number of things in terms of that growing that growing debate and discussion that we're having amongst communities like your community, and using that as a pathway for people to get the help that they need.
Mental Health Month theme this year is taking steps on your well-being journey. Mara, I'd like to ask, what is well-being and mental health? Could you just elaborate that for we're not, so we can differentiate?
Yeah, no, I like that question because I think that it's important to understand that well-being and mental health are two quite distinct but interdependent issues. and they are without well-being, your mental health is in jeopardy, and vice versa. So well-being is about the whole person. It's about your state of physical, mental, spiritual, social, professional state. It's all aspects of you, and so to have a good state of well-being, you need to be attending to all those aspects of who you are and how you live your life, and it's simple things like physical health, nutrition, recreation, physical activity, eating well, being engaged in meaningful activity within the community, having connection that keeps coming up, and those things are foundational. Mental health or mental illness is when your psychological state is struggling, and so our mental health is focused much more on, if you like, on the psyche, on things like mood, thinking, concentration, ability to problem solve, ability to sort of connect and get on with other people, and to progress in your life, and to manage your relationships and your work and your social life. And so one is connected to the other, but it's important to see that they're also quite different.
Monica, in terms of well-being and how now has, you've got this group. It's been how many years now when you first started Haathi in the Room?
I think about 8 years now.
8 years.
Yeah.
And how is that in terms of supporting your family and communities, and how has that helped with your well-being as well, and as well as your mental health?
Absolutely. So I guess it sounds a bit self-serving, but sometimes doing community work and volunteering and really giving back to the community actually helps you in your recovery journey. So I think, as I sort of mentioned, I started from a place of a lot of fear and kind of apprehension about sort of talking about this in my community, and now it's really, we've made such inroads in that, that fear is gone. And I think, it's certainly, I do this work, and I do some other volunteering as well, which definitely, as I said, makes me feel better. It actually helps me as part of, the suite of other things I try to do to maintain my well-being, which includes seeking professional help. So I see, for example, a psychologist very regularly, and a psychologist who's very culturally, who offers a lot of cultural experience as well. So it's definitely something I've learnt over the years, in the time that I've been a part of Haathi in the Room.
And Vince, that is important, finding someone, a person or individuals, communities that you feel comfortable with.
That's very true. I mean, that's a big challenge. Some people are lucky enough to find it straight away, and other people have to have a few goes at it. But as you're saying, Monica, I mean, I think the experiences of people can vary. You were born here, and you're the daughter of immigrants, I'm the son of immigrants. So there's a generational issue there in terms of how people see mental health. I was born here, and I was raised, in this system and in this society. So the way I would see it and the way I connect will be different to, say, my parents and how they connect. And you need a sort of an approach that is for you, and you need to test that out, because it is crucial, that relationship with someone who you can trust and who you can share your innermost thoughts with, and be confident that that person will manage that in a professional way, in a way that's non-judgmental but helpful, and really get to know you and how you experience things. I think is really critical.
And one messaging may be different for a different individual.
Oh, completely. And I think that we're focusing on the importance of being culturally attuned and sensitive, but you also need to be attuned to the age range. A message will resonate with an adolescent, which will completely miss an older audience, and so it's about the whole person. It's their age group, their cohort, and their cultural background.
Look, we've run out of time, but there's a lot of work done and a lot of work more to do, and I want to thank you for all the work, all the support, and as we continue to work together. But any last words, Monica? I'll go with you before we go. Any last thoughts and anything you'd like to share to audience, media, community, and health workers?
This conversation is just so important. So have them within your own communities, in your workplaces, because the more we talk about it, the less stigma there is, the less fear, and I think more progress can be made. So that's my kind of takeaway to everyone watching.
Well, thank you, Monica, for being here and for sharing your insights and your experience with us. Vince?
Just shout out to also the resources that are developed by Multicultural Health Communication Service.
And mental health branch.
Mental health branch. So some of the social media tiles, etc. So we've talked about some of the services available through Transcultural Mental Health Centre, through STARTS, etc. But there's also lots of resources that Multicultural Health Communication Service have. We'll be able to advertise that over the coming days to this audience. And all that information has a place and is helpful to people, and people will find information, will find aspects of that information particularly that resonate with them, and that's just the way people seek help and are able to secure help.
Well, thank you, Vince, for being with us today, and Dr. Murray Wright, thank you so much for joining us. Any last words?
Certainly. I think my message is to anybody who has a concern about someone either in their family or their community or their neighbourhood. It never does harm to ask someone and to reach out, and sometimes can be a life-changing experience. And so if in doubt, talk to someone and ask them how they're travelling.
And with that, thank you so much, and thank you for joining us. Again, resonating on the messaging, it takes one step. Talk to someone, reach out, and we hope that you enjoyed this session, and please share it amongst the community, and we hope to see you again next time. Thank you so much.